Hey everyone, welcome back to my channel. So in this video, I'm going to show you an example CCS case for the step 3 exam, and I'm going to show you how to do CCS cases step by step. So let's get started. So number one, the first thing I want you to look at, guys, when you're tackling a case would be the location. Now, the importance of location here is that it gives you an idea of the sequence you're going to do. Are you going to start with a physical exam, then a workup, and then management? Or are you going to try to manage the patient, stabilize them, reduce their pain, if it's an ER, for example, until further workup? So when it's in the office, usually the patient is stable and you're going to elicit that from the vital signs. Usually the complaint is not life-threatening, etc. Rather, if it's the ER, for example, then you're having a distressing complaint. The patient may not be stable, so you might want to look at the vitals. In that case, you're going to manage first, maybe give them oxygen, painkiller, whatever, until you figure out what to do for workup, what to do for diagnosis. You might not do a full physical exam, just a focused one, etc. Okay, so location is important here. Okay, because you are being scored for the sequence, not just for what you're ordering. Okay, so let's take a look at this case. You'd usually be presented with a history, and the history would usually be accompanied by vital signs. They don't usually give you a full physical exam. So if you're going in sequence in a stable case in the office, you'd usually have to order a physical exam yourself, and you're gonna tick over what to include in the physical exam. Is it just general examination or chest exam as well, heart exam as well, etc. You're gonna have to tick the check boxes yourself, and you're being scored for that as well. So let's take a look at this case and apply. So here we got a 32-year-old woman presenting with a chief complaint of chronic diarrhea. Okay, now it's been for the past 8 months, so obviously it's chronic, and she describes it as loose, bulky, foul smelling. So this is obviously steatorrhea with weight loss despite normal appetite, a significant weight loss of 10 pounds over the last few months. So here I want you to take note of the patient's chief complaint, which is chronic diarrhea, or let's say steatorrhea, and also take note of the patient's comorbidities and demographic. So she's a young female, right, with steatorrhea, and this steatorrhea has affected her general condition, has caused significant weight loss, right? And then the comorbidities, we're going to elicit that from her past medical history, right? Now, something else is important when talking about history would be the patient's social history. Now, why is this important? Because while you do management, you're going to be scored for whether you do counseling, whether you do preventive treatment, stuff like that. Like if you don't mention, like if the patient is a smoker and you don't mention smoking cessation, you can lose points, right? Now, if the patient, for example, is not having safe sex and you forgot to mention that, how to condoms or stuff like that, then you're gonna lose points. That's why social history is important. All right. Okay, so in the patient's past medical history and travel, there is no recent travel. This is ruling out our differentials, as we're gonna see. She doesn't know of any food allergies or dietary restrictions, no sick contacts for you to rule out possible infectious diarrhea, but we're still gonna have to do a workup for that. She denies fever, blood in stool, or nocturnal diarrhea for you to rule out IBD, right? But we still have to do a workup, and there is no past medical history of significance at all. you're just gonna go skim read over it quickly and only highlight or pick or take note of what's significant. So what is significant here is her family history. Her mom has hypothyroidism and there is no family history of IBD or anything. So you might want to put that in your notes. Okay? If she were a smoker or alcohol user, I would have taken note of that in order to include it in my preventive management, but there is none, so we're gonna delete it from our notes, right? So we're only gonna write what's important. And what's important here is her family history. Mom has hypothyroidism. All right, that's it. Okay. So given this, you're gonna base your next steps. Since we're in the office and the patient's vitals are stable, we don't need to move her to the ER. We can manage her here in the office as well, and we can do a full physical exam before the diagnostic workup. We're not really rushing. So now we know the sequence, right? So I'm gonna do a full physical exam on this patient, focusing mainly on the general exam. So we're gonna do a general examination and an abdominal exam. So when you do a full physical exam, you wanna check first the chief complaint, okay? Because the chief complaint has diarrhea, weight loss, stuff like that, you'd wanna include this. And based on your differential, you're gonna include any other physical exam. So maybe if you're suspecting celiac disease, you want to do a skin exam, right? In order to check for dermatitis herpetiformis. And it's a good idea to just include everything else on the check boxes. You're not going to lose points for that if we're in the office. But if we're in the ER and the patient has a distressing complaint, you might want to skip on that and only include what's important. Okay? So you're gonna take a point for the physical exam. Now we did a physical exam. The patient is a thin woman with a tired appearance and nothing else. But on the skin exam, she has small clusters of pruritic vesicles over the extensor surfaces of the elbows. So that is positive for dermatitis herpetiformis. So kind of reinforcing and proving that it could be celiac. Neurologic exam shows decreased vibration, sensation in the feet, so it could be B12 deficiency as well, maybe a complication of malabsorption or steatorrhea. So until now, we have a couple of differentials. So we did a physical exam, that's the step we did, right? The next step should be to do a diagnostic workup, okay? The sequence here is important, guys. Now, how am I going to do this diagnostic workup and make sure I order everything and I'm not order anything invasive or unnecessary? How can I do that? So for any condition, guys, I want you to categorize your workup into 3 categories. This is going to help you immensely with any case. The first category should be the effect on general condition. And that's something you'd usually order for most cases. For most cases, you'd want to do a complete blood count and basic metabolic panel. Okay? So for the general condition. The second category of diagnostic workup is to rule out the differentials. If you have a differential list, you'd want to do a screening test for each differential, as we're going to see. And the last one is specific to the complaint. So for example here, the complaint is steatorrhea. So you're going to do workup to prove steatorrhea, to prove that this is actually fecal diarrhea, or fat diarrhea, okay? It's malabsorption. So to prove the malabsorption. So in this case, because it's steatorrhea, we're going to do stool fat analysis, right? Could be qualitative, which is Sudan stain, or quantitative, which is 72-hour fecal quantitative fat test, something like that. Okay? So something specific to the complaint, something for the differentials, and something for the general condition. Okay? Now, for the general condition, we mentioned complete blood count and BMP. How is that beneficial, or how is that useful for celiac? Because it's malabsorption, right? Because it's malabsorption, it can cause anemia and iron deficiency, right? So we might want to check the complete blood count. It could be inflammatory bowel disease, so we might want to check the white blood cell count, right? BMP, or basic metabolic panel, includes liver function tests, kidney function tests, and electrolytes, right? And then there is other stuff that steatorrhea can cause. So because this is malabsorption, it affects everything else getting absorbed, including the fat soluble vitamins A, D, E, and K, and also other vitamins like B12, as we saw, folate, and iron, causing iron deficiency. So if we actually did a CBC, you might want to do iron studies as well, right? And obviously, we're not going to do levels for all those vitamins. We're just going to do levels for vitamin D. And we can infer whether vitamin K is deficient by doing coagulation studies, right? Now we're going to do levels of these vitamins. And you might want to add just any other mineral, maybe zinc, copper, stuff like that. So that's the effect on the general condition, the effect of steatorrhea, right? Now let's rule out the differentials. The differentials here is everything that causes chronic diarrhea and malabsorption. So celiac disease is the first on our list. For that, we might want to do a screening study and a diagnostic study. So a screening one would be serology. So celiac serology include anti-tissue transglutaminase antibodies, IgA, and maybe total IgA if the patient is IgA deficient, and a diagnostic test, which is upper GI endoscopy with biopsy of the small bowel. That one is diagnostic. Now, let's say we're suspecting lactose intolerance. In that case, you might want to do carbohydrates in stool, a D-xylose test. You might want to do that. Or for chronic pancreatitis, you want to do stool elastase, right? For SIBO, you might want to do a breath test. For IBD, you might want to do stool calprotectin, and inflammatory markers like ESR, CRP, maybe blood in stool, right? Which she denied, but we're still gonna make sure. For giardiasis, which is a parasite, you might want to do stool, ova, and parasites, right? So stool analysis alone, guys, if you choose that on the CCS cases, it's not gonna include everything. You have to choose each one separately. Stool OMP, stool elastase, you have to choose it. Viral and bacterial gastroenteritis, you might want to do viral PCR or antigen, bacterial antigen as well. For Whipple's disease, that one you're gonna have to do a biopsy of the small bowel. We're already gonna take a biopsy for celiac, and the same for tropical sprue, but those were ruled out because she does not have travel history, but we still want to make sure. So you see here, guys, how we categorized the workup in order to avoid missing anything, right? So for the general condition, to rule out the differentials, you're going to do one for each differential, and for the specific complaint. Now let's say it turned out to be celiac. So the next step would be management, right? For management, guys, on the step 3 exam, you're not just going to manage the condition, but you're also going to manage the effect of that condition, and you're also going to do preventive management. And preventive management, you're going to elucidate that from the patient's social history. So if she's a tobacco user, you're going to advise her to stop tobacco. Alcohol user, you're going to advise her Maybe she's obese, you're gonna advise her on weight loss, right? She doesn't do safe sex, you're gonna advise her on that. Maybe for teenagers, you're gonna do seat belt, stuff like that, okay? Now, that's for preventive management. Now, for the condition, obviously, because this is celiac, you're gonna advise her on a gluten-free diet. And because she might not know what every food contains, whether it has gluten or not, then you might want to refer her. And step 3 really likes consultations, guys, so you might want to refer her to a nutritionist or dietitian, right? Now, what else? You're gonna manage the effect of that condition. Because celiac has affected her by this malabsorption, maybe has caused iron deficiency anemia, so you might want to give her iron, right? Maybe it has caused her B12 and folate deficiency, so you're gonna do supplementation for that. Maybe it has caused her to be maybe osteoporotic, right? Because of vitamin D deficiency, so you might want to give her vitamin D and check if she really got osteoporosis with a DEXA scan, etc. Okay, now in preventive management, I forgot to tell you guys that vaccines here are important. So if there is no mention of a vaccine that the patient should have taken, let's say she doesn't remember when she last took a Tdap, for example, or screening tests. She doesn't remember the last time she did a pap smear. Maybe she's 50 plus and she never did a mammography. So these stuff you gotta mention, maybe a colonoscopy too. So any screening, any vaccinations, anything with social history, you'd have to include that with preventive management. All right, guys, so diagnostic workup has 3 parts and preventive management has 3 parts in order to get the full mark or to get a really high percentage on the CCS cases. And the sequence here is important based on the patient's complaint and stability, which is based on their vitals. Okay, now if the patient's unstable, obviously you're gonna have to send them to the ER and not manage them in the office, right? If the patient needs to stay a little bit in the hospital for further workup, you might want to move them to the inpatient unit. Okay, just like you would in the hospital. Okay, hope this video helped, guys. Let me know what you think. All the best.